Christian. Right, so if you have read and understood considering its surgical and augmentation, kindly please tell me if you can identify the structures. What are you looking at exactly?
Okay, so this is a image of pelvis from the back side.
Yes.
You can
Showing?
see showing muscle of the hip and
Yes.
bones like
Organized into deep and
pelvic bone and
superficial.
sacrum,
Yes.
yeah,
Yes.
and deep and superficial group of muscle.
Very good. So can you please identify this big bulk of muscle?
Is a gluteus maximus,
Very good. Can you identify this muscle over here?
gluteus medius,
Right, excellent. If you can please identify muscle on the right hand side, this one.
okay, this one is piriformis,
Yes.
left piriformis.
Yes. If you can identify this muscle,
It's gluteus minimus.
what is the nerve supply of this muscle?
It's superior gluteal nerve.
Very good. If you can identify this muscle over here. This lower.
Okay, this one is quadriceps.
Very good. Femoris.
Quadratus femoris, yes.
Can you please tell me the origin and insertion of this muscle?
Okay, this one is originated from the ischial tuberosity and inserted into the intratrochanteric line.
Where?
Intratrochanteric line
Of?
femur.
Yeah, all right. Here it says the quadritubercle of the femur. Can you please
Okay,
tell
yes.
me what is the nerve supply and action of this muscle?
Okay, so nerve supply is nerve to the quadratus femoris.
Good.
And action is external rotator.
Lateral rotator of the thigh.
Lateral rotator, yes.
All right. Can you please identify which bones are you looking at?
Okay, so it's a different view of femur.
Very good. Can you identify number 3, please? In
It's the
picture
head of
A.
the femur.
Okay. If you can identify 6, please.
And neck of the femur.
2, please.
Greater trochanter.
4, please.
Intertrochanteric crest.
All right. 5, please.
5. I'm not very sure. Maybe gluteal tuberosity.
9, please.
9 is surgical neck of the femur.
11, please.
It's a trochanteric fossa.
Okay, coming here on the right hand side, if you can identify 12.
12. I'm not sure, but it's not. I think 5 is intertrochanteric line. So 12, I'm
Okay.
not sure.
Can you mention all the structures which are inserted here? At
Okay, so
number
there
5.
is a pectineus, and then gemellus superior, gemellus inferior, obturator externus, obturator internus, and in the trochanter is gluteus medius and gluteus minimus.
How the hip joint is formed?
So hip joint is formed by 3 bones make acetabulum, and
Please mention the names of the bones as well.
okay, so is ilium, pubis, and
Yes.
ischium.
Yes,
They
and
combinedly make acetabulum and the head of the femur.
Okay. Which structures strengthen the hip joint?
Sorry, ma'am?
What are the names of the structures which strengthen the hip joint?
Okay, so is the depth of the acetabulum and acetabulum labrum and the muscle and the ligaments.
Okay.
And the angle of the femur as well.
Yes, not angle of the femur, the neck of the angle of the neck of the femur. Okay, how
Yes.
much is it normally?
Normally, I think it's
130.
130 degree, yes.
Yeah. All right. If we can move forward, what do you see? What kind of image is this, please?
Okay, so this is a angiogram of, I think it's femoral and iliac artery.
Not think, just tell for sure.
Yeah.
Okay, can you please identify number 2 over here?
So number 2, femoral artery, common femoral artery.
Yes. 3, please.
3, medial circumflex artery.
Okay, quickly, if you can identify number 6 and 7.
So number 7 should be superficial femoral artery, and number 6 is profunda femoris.
Okay, can you give some indications in which condition would you ask for this imaging?
For pelvic fracture
And
to identify the obstruction level in case of acute ischemic condition of the legs or maybe gangrene of the leg.
okay. All right, moving forward. Can you identify the marked structures beginning from here, please?
Okay.
Which vessel is this? And again, what type of
so
image is this?
There's also a angiogram.
Of?
I think is on the popliteal region.
Very good.
Yeah.
Leg. All
So
right. So then it will be easy for you to identify this vessel.
Yeah, so this one is a tibial artery.
It's popliteal.
I mean the popliteal artery.
It's popliteal artery, yes.
Yeah.
And then number 2, this one.
So this one is a tibioperoneal trunk.
Very good. Number 3. This
Is anterior tibial.
Good.
Posterior tibial artery.
This is anterior, it says. Which one is this?
Okay. Oh, this one is a posterior tibial artery. Yes.
This is peroneal. This is posterior.
Not the most lateral one is peroneal.
This one is posterior. No, in between, this one is peroneal. This is the posterior.
Oh, okay. I thought the most lateral one is peroneal.
No, that's how it is. Okay, can you please tell me? Right, if you can, right, I wanted to ask you what more. Right. Right. If I can ask you more. Okay, can you please tell me about the course of the sciatic nerve?
Okay, so sciatic nerve is formed from the lumbosacral plexus, L4-5-S1-2-3.
Yes.
Then it comes to the pelvis and is exit the pelvis through the greater sciatic foramen.
Yes.
Then it comes to the back of the thigh, and from the upper end of the popliteal fossa, then it divided into tibial and common peroneal nerve.
Where
so
exactly?
The common peroneal is the apex of the popliteal fossa.
Okay. Then?
And then common peroneal nerve is divided into 2, superficial peroneal and deep peroneal, and tibial nerve goes straight as tibial nerve. So it supplies all the posterior compartment muscle of the leg, and common peroneal, superficial peroneal supplied the lateral compartment of the leg, and deep peroneal supplied the anterior compartment of the leg.
Okay, right. Thank you.
Okay.